Thank you, Danijela, for coming. We had a 2-day meeting just now to discuss our cooperation activities with Western Balkans and Turkey. And I'm very happy to have you here representing Serbia. Thank you for coming.
It's my pleasure.
Danijela, what do you consider the most significant achievement for your country during the participation of ECDC accession support activities?
I would like to underline that we have a long tradition of taking part in selected but many networks of the experts, and it is a unique experience to share experience formally and informally between colleagues, and also to discuss with them, for instance, a revision of the case definition, what variables are most useful, challenges about data collection, etc. Secondly, it was very important for us because we have a very detailed assessment of surveillance system and the control of diseases as well as laboratory in 2013 by ECDC and the European Commission, and now this year we have opportunity in April to have as ECDC technical visit when we make assessment of our surveillance system using very structured questionnaire. So I appreciate that tool for the assessment, which I think it is very useful. Not even for this purpose at this moment, but for periodical assessment of the system, because that questionnaire includes all the parameters of the surveillance system, which should be in the future. Then, of course, many trainings, many workshops we take part. It's extremely also important. But on the second, we have opportunity, which is very important for us during this program, to take part in EuroGASP study, as well as EuroGenNet, which is important. We recognized that molecular and genomic surveillance are very important, as well as antimicrobial resistance of some pathogens. So this is a unique opportunity for our country to take part, to learn from each other, and to improve the system. And we are also have opportunity to take part in the joint surveillance on respiratory viruses, which is now of the great paramount, because this is imperative to have in our surveillance system. And we also have opportunity to report selected diseases through TESI. This is very illustrative, very informative for us, and we are waiting and thinking that it will be good to expand that diseases to be more reported to TESI, because then we are learning and we are then more operational and capable to suggest some changes in the surveillance system, including variables which will be collected. And there are many other, how I said, activities which we appreciate a lot, and we are waiting for the next year to have a country visit on One Health against antimicrobial resistance, and after that to have a roadmap to improve that system and intersectorial collaboration, and we are hoping that we'll have opportunity together with ECDC and to work on the development of electronic surveillance against MR.
You mentioned capacity building activities and training as a good achievement. So I would like to ask you, what kind of additional training or educational support would be most helpful for your country's public health workforce capacity building?
Yes, I would like to mention the first point that we have opportunity, and we use that opportunity to participate in MEDIPIET training program, and we have very successful fellows, but we have needs for that program to be continued, because it's an excellent program, but if it is possible in the future. And then when we are looking at other possibilities, yes, we already highlighted during the previous meetings that some very practical trainings, like using our software for analysis of data, and some other like short presentation of the using EpiPulse. Then when we are talking about the area of preparedness and response, we recognize that event-based surveillance, which need to improve, should our experts would like to have a training of epidemic intelligence, different tools, and to share experience with other colleagues from the member states, because we are interested in that part, especially when we now recognize that some diseases will be only event-based surveillance, so we are willing to learn more. And also, we are interested to have training or the workshops about, or even to have simulation exercise and after action review. Even we already have some trainings on that issue. It is extremely important to learn more. Also, rapid risk assessment, to be able, as much as it's possible, to make risk assessment and to detect on time threat of public health concern. So this is our thinking, and it is the mostly what we are looking for, but also all other support and the trainings and the workshops are very appreciated.
Thank you, Danijela. Thank you. It's very good to hear that, and we take that into consideration for our future cooperation.
Thank you again.